Understanding schizophrenia, an introduction. Schizophrenia is a serious mental illness. It affects how a person thinks, feels, and behaves. Many people misunderstand this condition. It is not about having a split personality. Schizophrenia is a chronic condition. It can be a lifelong challenge for those affected. Understanding it is the first step to helping. This condition can deeply impact a person's daily life. Simple tasks may become very difficult. Holding a job and maintaining relationships can be a struggle. The world can feel confusing or frightening. This is because their perception of reality is altered. It is important to remember this is an illness. It is not a choice or a personal failing. People with schizophrenia need compassion and support. They deserve to live with dignity. Greater understanding of schizophrenia helps everyone. It helps reduce the stigma often linked to mental illness. Stigma can make people afraid to seek help. When we learn the facts, we can fight this stigma. We can create a more supportive environment. Schizophrenia affects people all over the world. In this essay, we will explore schizophrenia in detail. We will look at what it is, what might cause it, and common signs and symptoms. Finally, we will cover treatments and ways to cope. Classifying schizophrenia, a psychotic disorder. Schizophrenia belongs to a group of mental illnesses called psychotic disorders. Psychotic means a person may struggle to know what is real. They might experience a break from reality. They may see or hear things that others do not, or they might hold strong beliefs that are not true. These experiences can be very distressing. They are a core feature of schizophrenia. This illness is often described as being on a spectrum. This is known as the schizophrenia spectrum. There are other related psychotic disorders too. This means the illness can vary a lot. It affects different people in different ways. Some people may have very severe symptoms, others might experience milder forms. The type and intensity of symptoms can change over time. Understanding this spectrum is important for proper care. It helps tailor treatment to the individual. Schizophrenia is a genuine medical condition. Think of it like other chronic illnesses. Schizophrenia affects brain health. This distinction is vital. It helps remove blame and encourages empathy. Schizophrenia is different from other mental health conditions. Unraveling the causes. A complex interplay of factors. Scientists do not yet know the exact cause of schizophrenia. It is a very complex illness. There is no single factor that leads to it. Instead, it seems to be caused by a combination of things. These factors interact with each other. Research is ongoing to understand these causes better. This will help us find more effective treatments. Genetics seem to play an important role. If you have a close family member with schizophrenia, your risk is higher. This suggests that genes are involved. However, genes are not the whole story. Many people with a family history do not develop it, and many people who develop it have no family history. Brain chemistry and brain structure are also involved. Neurotransmitters are chemicals in the brain. An imbalance in these chemicals is thought to contribute. Dopamine is one such neurotransmitter often mentioned. Environmental factors can also increase the risk. Stressful life events can be a trigger. Using certain street drugs can also be a risk. Recognizing the signs, key symptoms of schizophrenia. The symptoms of schizophrenia can vary a great deal. No two people will experience the illness in exactly the same way. Symptoms can also change over time. Sometimes they develop slowly, over months or even years. Other times they can appear quite suddenly. Doctors often group the symptoms into different categories. This helps in understanding and treating the condition. Recognizing these signs is the first step towards getting help. One category is called positive symptoms. These are experiences that are added to a person's normal experience. Hallucinations are a common positive symptom. This means seeing, hearing, or feeling things that are not there. Hearing voices is the most common type of hallucination. Delusions are another positive symptom. These are strong false beliefs that are not based in reality. Disorganized thinking and speech are also positive symptoms. Another category is negative symptoms. These refer to a loss or decrease in normal functions. Reduced emotional expression is one example. Lack of motivation, called avolition, is also common. Social withdrawal and speaking less or alogia are other negative symptoms. Finally, there are cognitive symptoms. These involve problems with thinking processes. Section 5. The impact on the brain. How schizophrenia affects neurological function. Schizophrenia is understood to be an illness of the brain. It causes noticeable changes in brain structure and function. These changes are complex and not yet fully understood. Scientists use tools like brain scans to study these effects. Magnetic resonance imaging, or MRI, is one such tool. Functional MRI, or fMRI, can show brain activity. These technologies help us see how schizophrenia affects the brain. This research is vital for developing better treatments. One key area of impact is the brain's chemical messaging system. This system uses neurotransmitters to send signals between brain cells. In schizophrenia, these systems seem to be disrupted. The dopamine hypothesis is a long-standing theory. It suggests that an overactivity of dopamine contributes to symptoms. However, other neurotransmitters are also involved. Serotonin and glutamate pathways are also thought to be affected. Researchers have also found differences in brain structure. Some people with schizophrenia have enlarged ventricles. There can also be a slight decrease in gray matter volume. These structural changes can develop over time. Section 6. Diagnosing schizophrenia. A careful clinical assessment. There is no single, simple lab test for schizophrenia. Doctors cannot use a blood test or a brain scan alone to diagnose it. Instead, the diagnosis is made by a qualified mental health professional. This is usually a psychiatrist or a clinical psychologist. They have special training in mental health conditions. The process involves a very careful and thorough assessment. This is important to ensure the diagnosis is accurate. The assessment is comprehensive. It usually includes detailed interviews. The professional will talk to the person experiencing symptoms. They may also ask to speak with family members. This helps get a fuller picture of what has been happening. A medical history will be taken. The professional will also rule out other possible causes for the symptoms. For example, substance use or other medical conditions can sometimes mimic psychosis. Mental health professionals use diagnostic criteria. These are found in manuals like the DSM-5. For schizophrenia, symptoms must be present for at least 6 months. There must also be significant impairment in daily functioning. Section 7. Debunking myths, separating fact from fiction about schizophrenia. Many myths and misunderstandings surround schizophrenia. These myths can create fear and prejudice. This is known as stigma. Stigma is a major problem for people with schizophrenia. It can make their lives much harder. It can lead to discrimination and social isolation. It is very important to separate the facts from the fiction. Understanding the truth can help us support those affected. It can also help reduce harmful stigma. One common myth is that people with schizophrenia are often violent. This is largely untrue. Most individuals with schizophrenia are not violent. In fact, they are more likely to be victims of violence. They are also more likely to harm themselves than others. Another persistent myth is that schizophrenia means having a split personality. This is completely false. Schizophrenia does not involve multiple personalities. That is a separate and much rarer condition. A very damaging myth is that people with schizophrenia cannot recover. While schizophrenia is a chronic illness, recovery is possible. With proper treatment and support, many people can work. They can have relationships and be active members of their communities. Section 8. Pathways to treatment managing schizophrenia effectively. Treatment for schizophrenia is usually a lifelong process. The main goals are to manage symptoms. It also aims to improve the person's quality of life. And it helps them function as well as possible. There is no one-size-fits-all treatment. A combination of different approaches often works best. This is called a multimodal approach. Treatment plans should be tailored to the individual's needs. Close collaboration between the person, their family, and healthcare providers is key. Antipsychotic medications are a cornerstone of treatment. These medicines can be very effective. They help to reduce positive symptoms. Symptoms like hallucinations and delusions often improve. They work by affecting neurotransmitter systems in the brain, particularly dopamine. There are older, first-generation and newer second-generation antipsychotics. Newer ones often have fewer troubling side effects. However, all medications can have side effects. Regular monitoring by a doctor is very important. Finding the right medication and dose can take time. Psychosocial therapies are also a vital part of treatment. These therapies help people cope with the illness. Cognitive behavioral therapy for psychosis, or CBTP, is one type. Family therapy can be very helpful. Section 9. The journey of recovery, progress, healing, and coping strategies. Recovery from schizophrenia is a deeply personal journey. It is not always about finding a complete cure. For many, recovery means learning to live well with the illness. It means managing symptoms effectively. It means achieving personal goals and having a good quality of life. Progress can be gradual, with ups and downs. It is important to maintain hope and celebrate small victories. Each person's path to recovery will be unique. Patience and persistence are essential. A strong support system is incredibly important. This includes family, friends, and healthcare professionals. Understanding, patience, and encouragement from loved ones can make a huge difference. Support can help reduce feelings of isolation. It can provide practical help when needed. It also offers emotional comfort during difficult times. Open communication within the support network is vital. Everyone needs to work together as a team. This collaborative approach fosters a healing environment. Individuals with schizophrenia can learn coping strategies. These strategies help them manage their illness day to day. Sticking to the agreed treatment plan is crucial. This includes taking medication as prescribed and attending therapy. Learning to manage stress is also important. Techniques like mindfulness or relaxation exercises can help.